All right, let's talk about something that affects millions of women but is still kind of confusing for so many of us, polycystic ovary syndrome, or PCOS. You've probably heard the term PCOD thrown around too. We're going to break down what it is, what to look for, and what you can actually do about it. Let's jump right in.
So, let me just start by asking you a few questions. Are your periods all over the place? Are you dealing with stubborn acne that just won't clear up? Or maybe you've been noticing more hair than usual in your brush. If you're nodding along to any of this, you are definitely in the right place.
And the first thing I really want you to hear is that you are so not alone in this. A lot of women just chalk these things up to being normal, but today we're going to peel back the layers and really understand what could be going on.
Okay, so first things first, let's just get down to the basics. What are we even talking about when we say PCOS?
You know, in simple terms, polycystic ovary syndrome, PCOS, is a hormonal disorder. It messes with how your ovaries are supposed to work. Now, you might hear people use PCOD and PCOS interchangeably, but PCOS is a bit more complex. It's more of a metabolic syndrome. And it's that hormonal imbalance that triggers all those symptoms we just mentioned, like wacky periods, weight gain, and acne. Just getting that basic idea is a huge first step.
So how does this actually show up in your day-to-day life? In this next part, we're going to focus on the specific red flags that are honestly way too easy to ignore.
In fact, there are about 10 critical warning signs. And what's really interesting is how many of us experience these things separately and never, connect the dots to see the bigger picture.
So what should you be looking out for? Well, there are the irregular or totally absent periods. That stubborn acne that just doesn't care about your skincare routine. Noticing your hair is thinning out. But then, on the flip side, you might see unwanted hair growing on your face or body. And of course, that feeling of constantly fighting a losing battle with weight gain, even when you swear you're doing everything right. These are all major clues.
All right, so maybe a few of those signs are ringing a bell. The next question is obvious, right? What do you do now? So let's walk through how a doctor actually figures this out so you know exactly what to expect. Getting a proper diagnosis isn't just a guess based on your symptoms. It's really a three-part investigation. First, your doctor's going to dig into your medical history, and your family's history too. Second, they'll do some blood tests to see what your hormone levels are actually doing. And third, they'll probably do a scan to get a good look at your ovaries.
Now, speaking of scans, this is a big one. This is where a lot of us can start to feel really anxious. You get your report, you see some long, scary-sounding medical term, and your mind just starts racing. But the most important thing to do in that moment? Don't panic.
That scary term you might see is bilateral polycystic ovaries. It sounds really intense, I know, but all it really is a description of what the doctor saw on the screen, that there are these little cyst-like follicles on the ovaries. But here's the key thing I want you to hear. Seeing that on a report is just one piece of the puzzle. It is not a diagnosis all by itself.
Okay, now for the part that puts the power back in your hands. You've got a diagnosis, so what now? This next section is all about what you can do. It's your action plan.
And this might be the most important thing we talk about today. Your lifestyle is your #1 tool. It is your first and most powerful line of defense. The simple things you do every day can make a huge difference in managing your symptoms. So what does that actually look like? Well, think of it as 4 pillars. First, diet. You want to focus on keeping your blood sugar stable. Then, exercise. Moving your body consistently helps it use insulin better. Third, sleep. We all know bad sleep throws everything out of whack, especially our hormones. And finally, stress. You've got to manage it because that stress hormone cortisol can make everything worse.
But look, sometimes you can do all the right things with your lifestyle and it's still not enough. And that is perfectly okay. It's so important to know that there are really effective medical options out there, from medications to other therapies that can give you the support you need.
All right, let's zoom out and talk about the big picture for a minute. In this last section, we're going to tackle those really important long-term questions about health and having a family that I know are on your mind.
This is a tough question, so let's just get right to it. Is PCOS dangerous? It's a really valid thing to worry about.
And the honest answer is, if it's left unmanaged, yeah, it can increase your risk for other health problems down the road, like diabetes and heart issues. And that's exactly why being proactive is so important. This isn't just about feeling better today, it's about protecting your health for the long run.
And that brings us to the other major worry that so often comes with a PCOS diagnosis. What about fertility? Are you worried about whether you'll be able to have kids?
And I really want you to take this message in because it is so full of hope. With the right care, the right management, and a good plan, pregnancy is absolutely possible. It might look different for everyone, but there are so many ways to build a family.
At the end of the day, if you remember one thing, let it be this. There is no one-size-fits-all fix for PCOS. It looks different on everyone. The best thing you can possibly do is work with a doctor you trust to create a plan that's made just for you.
So as we wrap this up, please don't feel like you have to go out and overhaul your entire life tomorrow. That's not what this is about. It's just about starting somewhere. So I'll leave you with this one question. What is one small, tiny step you can take for your health today?